My name is Keith Zafren. I am 62 years old. I am married to the absolute love of my life, and we have 3 grown boys who we're very close to, thankfully, and we are super proud of. I was shocked when I was diagnosed with lung cancer back in April of 2018 because I had never smoked a cigarette in my life. I have lived a very active and healthy lifestyle. The diagnosis came out of the blue. I had pneumonia a few months prior, had a chest x-ray to confirm that, and on that chest x-ray they saw a little lump in my upper left lobe, another one in my lower left lobe. And so after a series of scans, we did a bronchoscopy in April of 2018 to do biopsies, and that's what revealed the lung cancer diagnosis. As I said, we were shocked. Really hit us out of the blue. At that time, we didn't realize how many people do get lung cancer who've never smoked, but it was a shock to us. So that led to a series of procedures. My upper left lobe was completely removed. In my lower left, they did a wedge resection to try to cut out the tumor, but still leave a little bit of the lung. Unfortunately, the surgeon accidentally cut through a little bit of the tumor. So some of that tumor in my lower left lobe was actually left inside me, which of course later became a problem. After the surgery, we went through a series of pretty intense 2 different kinds of chemo treatments for the remainder of that year. Again, unfortunately, the chemo actually didn't work. It didn't really do anything for the tumor that was left and all the suspicious nodules that were everywhere else in my lungs. So not too far into our journey, early 2019, my oncologist back in Kentucky where we lived essentially already told us that we were out of options, that they couldn't do any more surgery because I had nodules everywhere. Same reason they couldn't radiate, and the chemo didn't really work because they had determined I had 2 different kinds of cancer and 2 different mutations. So I was a bit of a complicated case. And like I said, as early as 2019, our oncologist said, there's not really anything else we can do. So it was our first death sentence. We were essentially just waiting for me to get worse and die. But my wife, who you got to meet, filled with positivity, filled with lighthearted humor that kept this journey going. She said to me way back then, you just need to hold on. You just need to live as long as you can, because even though they're telling us we're out of options now, you never know what's coming down the pike. There are new medical treatments, new medical procedures being discovered all the time. She says, you just hold on and keep living, because the longer you do, we're going to find an option. Well, she was right. 2 years later, my oncologist informed us that this special drug, this EGFR inhibitor, which fit the cancer I had been in a closed special clinical trial. It was called Tagrisso. It was only available to late stage, 4th stage cancer, lung cancer patients. So I didn't qualify for that, because even though I had these 2 different kinds of cancers and 2 different mutations, it was very hard to stage me, but I was not stage 4 because my oncologist had determined that all those different cancers and mutations were all primary, meaning they had all grown on their own. None of them had metastasized or spread. So even though I had a lot going on in there, I wasn't stage 4, and therefore I wasn't qualified for that trial. But 2 years into our journey, that drug was working pretty well in the trials, well enough to be expanded outside that limited scope of 4th stage lung cancer, and it became available to early stage lung cancer patients. So my oncologist got me into that trial, started on that drug. 3 months later, I had a new CT scan, And it revealed that not only that little tumor growing in my lower left lobe, but by this time I had a tumor in my upper right lobe, which was also primary, thankfully. In just 3 months, that scan revealed that both of those tumors had shrunk a little bit from that medicine. So we were thrilled. It seemed to be working. It was working. It continued to work for a couple of years, not in the sense that the tumors didn't grow. They did start to grow again, but very, very, very slowly, thankfully, because of that medicine. And then after about 2 years, the medicine started to stop working. So on August 2nd last year, 2022, my wife and I were again blindsided. We went in to see our oncologist like we did every 3 months. We'd get a new scan, go in for review. But at this meeting, again, we were blindsided. My oncologist said to us, the tumors are growing again. The Tagrisso has stopped working. And I'm very sorry to say, but this is the end of the line for you. He said, we have no other options. If you go on palliative chemo the rest of your life, you might have 2 years to live. If you don't do chemo, probably much less. Again, this was August 2nd, 2022. That's tough news. What do you think my wife said? She said, you hold on. You just do not give up hope. I know the oncologist is saying this is your second death sentence, but we had a death sentence, she said, 3 years ago. And look, you're still here. You're still symptom free. Just hold on. So after that meeting with the oncologist, where he told us this was the end, I had already heard about what was happening here at Northwestern Medicine. I'd seen the media clip about the first 2 patients that they experimented on doing a double lung transplant for late stage cancer patients whose cancer was limited only to their lungs. They were out of all other options. All options they had tried were not working. And they experimented because they had learned from COVID a new way of doing double lung transplants that might work for cancer. They had 2 successful surgeries. As a result, we're able to get funding for a new clinical trial they call the DREAM study. And I took things into my own hands. I made phone call after phone call after phone call to Northwestern until I finally got to the lung transplant team. As a result of that phone call, we were scheduled for an intake call with Dr. Che, the oncologist here at Northwestern. And my wife and I had quite a long call with him where he asked us a bunch of interview type questions to pre-qualify me to see if I might be a candidate for the program. This was now in November of 2022. He did pre-qualify me. He had me do 3 other exams in Kentucky to make sure that cancer had not spread to my brain or to the lymph nodes or anywhere else in my body. All those tests thankfully came back showing that was the case. So we scheduled a call with Dr. Kurihara from the thoracic surgery team, who again pre-qualified me, but very interestingly said to me, although you seem like you might be a candidate for the program, you're not sick enough for us to take you in yet, which seemed crazy. But what he meant was that I was not yet on supplemental oxygen. He said, until I am, and until my lungs are failing, I would not get placed on the donor recipient list, because of course this surgery was so brand new that UNOS list, that recipient list, the qualifications had not caught up yet to this kind of surgery. And the difficulty with this is that I had cancer. I had cancer all through my lungs, and the longer we wait to get on that list, the chance the cancer will spread outside my lungs, and then I wouldn't qualify. And I would be headed toward death. So it was a tricky time. But this again was this was December of 2022 when we were told you're not sick enough. So somehow, I don't know if it was just my will or luck or fate or divine intervention, but in January, a month after that phone call, I got pneumonia. It took me about 2-3 weeks to recover from that pneumonia, which I did. February was okay, but by March, I got pneumonia again. Ended up in the hospital at University of Kentucky, and essentially never really left the hospital after that. I had 2 rounds of pneumonia. I was discharged for only a day and got sick again and was right back in the hospital for another 2 weeks. And then during that stay is when they put me on 3 liters of supplemental oxygen to keep my O2 saturation above 90. And I never came off that oxygen. After several weeks of getting more and more sick at the University of Kentucky, the team here at Northwestern decided to transfer me here for all of those pre-qualifying procedures to find out if I really would be a part of the DREAM study. So we were discharged from the hospital in Kentucky. We went home to pack, and the next day, my wife packed the car with all of my oxygen tanks in the back seat, and we drove here to Chicago mid-April this year, 2023, to do our patient education, admit me to the hospital here, and go through about 15 different tests and procedures to make sure that I qualify for the study. At the end of that, we did. They said we can't put on that donor recipient list until we move here to Chicago. So we packed the car full of all my oxygen tanks again. I was now on 6 liters by this point. We drove back to Kentucky, and we packed up our entire house to move and put it on the market for sale in 2 weeks, which my wife did the lion's share of that because I was on 6 liters of oxygen. I was coughing constantly, spitting up mucus, and tired. Our youngest son came over every day during that time period to do all the manual stuff that I just couldn't do while my wife packed everything. And in 2 weeks, we left. We drove to Chicago on May 15th, moved into our little apartment in the sky. And by June 4th, I was placed on the donor recipient list here. And then the wait, the long, long wait began. We had been told that it was about a 2 to 4 week average wait time. So we had our hearts set on that. Once it went past 4 weeks, it just got really tough. And, honestly, I wasn't sure I was going to survive. I was now on 9 liters of oxygen at rest, barely keeping my oxygen above 90. I was coughing constantly. My wife said it was like a mucus factory because I was spitting up all the time, carried what we affectionately called my spit cup everywhere we went. And I was literally dying. 6 weeks ago, I was dying. Now get this. Remember, August 2nd, 2022 was the day our oncologist said it's the end of the line. You don't have long to live. 1 year later, to the day, August 2nd, 2023, we got the phone call from Morgan, our lung transplant outpatient nurse who had guided us through the whole process since April. She called on August 2nd and said, come to the hospital. We have beautiful, new, healthy, young lungs for you. So it felt divine. We came to the hospital at 5 p.m., had my surgery, the 7.5-hour surgery the next day, August 3rd. And here I am at the time of this interview, exactly 6 weeks out of surgery. I am breathing beautifully. I have energy. I'm healing. It's literally a miracle. I know that was a long story, but it is our story, and I'm so, so grateful to be sitting here after 2 death sentences, alive and well and ready to live the rest of my life. thanks to these brilliant surgeons and doctors here at Northwestern. I'd like you to see two pictures. This first one is in the step-down unit the day that I was discharged from the hospital 11 days after my surgery. You see the bell. They have us ring this bell before we leave the hospital as kind of an announcement that, we're getting out. And the most amazing thing is that it's right there in front of the nurses station. And when my wife and I there rang the bell, all of the nurses are clapping and hooting and hollering and celebrating. And it was just such a nice homegoing. And you can see how happy we are. You can also see my shirt that my wife bought for me to wear on my day of discharge. I don't know if you can read it, but it says, "Lung transplant survivor, forever grateful to the organ donor hero who saved me." Oh, what an awesome shirt. And I'll just mention that, about a week after I got out of the hospital, I was able to write a letter to our donor family. The only thing we know about my donor is that he was a young man. So a family lost a son, and that's, with organ donation, it's a little complicated all the time because there is this amazing gift of life to me, and yet in order to make that gift, somebody lost their life. So in our letter, we wanted to express our tremendous gratitude for this gift, but also our compassion toward the family who, in their loss and their grief, made a decision to save another life. Pretty amazing. The second picture, I just think, tells the whole story. About 3 weeks after surgery, we went in for a normal pulmonary clinic visit, and my nurse practitioner put these two scans up on the screen next to each other. The one on the right is my CT scan of my lungs from April of this year, and you can just see, even to the untrained eye, how cancer-filled those lungs are. All the cloudy white, all of those white spots that are tumors. When I saw that, I thought, how was I even breathing? That's why there was that need for all that supplemental oxygen. The picture on the left is 3 weeks after surgery. My beautiful, clean, healthy, still expanding lungs. And you just look at those two side by side, and that picture absolutely illustrates the miracle that the surgery is and the hope that so many more people are going to have because of what they're doing here at Northwestern. Yeah, I think I kind of touched on that just now, how I needed so much oxygen 24/7. The coughing, the mucus, the difficulty doing anything, the lack of energy, and all of that is changed now. No supplemental oxygen today. I'm thrilled, I'm happy, I feel good. There are up days and down days. Today happens to be an up day, so I'm very grateful that happened on the interview day. But there are days where I'm just so tired, I'm napping 3 or 4 times a day. And I just talked to my nurse about it this morning, actually, and she said that is totally normal, that they literally cut me in half. They do this, they call it a clamshell opening. They put me on heart and lung bypass, take both lungs out, clear the airways, put 2 new lungs in, and then stitch everything back together. They cut the venous nerve, they cut my sternum in half, nerves. It's major stuff. And so even though I'm doing, really well on the outside, my incision is healing beautifully. I got all my staples out 2 weeks ago. Such a relief. There's a lot of healing that has to go on inside my body still. And, sometimes it's just, I'm exhausted from it. Sometimes I'm in a little bit of pain still, but for the most part, I'm not, and I'm really only taking Tylenol for the most part, a few other pain meds sometimes. But, again, I don't think there'll be anything I can ever complain about the rest of my life. It feels like I'm a walking miracle. One word, fantastic. Literally everyone we have come in contact with. I already mentioned Morgan, our lung transplant nurse, who did our patient education mid-April and then guided us every step of the way until that day she made the call for us to come. I already mentioned our calls with Dr. Che, Dr. Kurihawa. Dr. Kurihawa was eventually the surgeon who performed this miracle and literally saved my life. And then Dr. Tomich from pulmonary, Dr. Arun, Dr. Myers, all from pulmonary, have provided constant care. Dr. Tomich, when I was here for 2 weeks in April, I got to see him every day and updated me on all my results. And the one who eventually told me that, we're welcomed into the study. But the aftercare has been amazing. And literally every nurse I had in ICU, in the step-down unit, I mean, the care here has been literally world-class. And I'm so grateful. Everyone has been fantastic. Well, as I was saying, as good as that care was, it just makes it so much easier to accept what's happening. People would explain everything. I had so many questions, and nurses, doctors would give me explanations. They provided such loving care. The nurses, especially the overnight nurses, my gosh, what they do over there is amazing. And so with all that care, all that positivity around me, it makes it that much easier to be positive myself and to realize I'm healing. They were so encouraging. Every time I was able to get myself out of bed, or when I started walking the halls after surgery, everyone was so positive and encouraging. It just makes you want to heal. And I think that was something I'm super grateful for too. I'm going to say that day at the end of those, I think I was here 2 weeks in April, when Dr. Tomich came into my room after the last test, and he said, you've passed everything. We are inviting you into the study. And all that encouragement from my wife for years saying, hold on, we will find an option. It's like it all came together in that moment and said, you are not going to die. You are going to get new lungs, and this is all going to change. So I think that moment when Dr. Tomich said, we're good to go. Do you want to do this? Yeah, I think for us, it may not be a moment so much as the process of waiting so long. And in that process, so I want to say, I think it was day 55 when Morgan first called us and said, we have lungs for you. Now, they are hepatitis C, and we had already agreed to take hepatitis C lungs because it is curable. It's not ideal, but we were told that we probably would get lungs quicker if we accepted hep C infected lungs. So she did call on that Friday, said we had these hep C lungs, get ready, come to the hospital. So we started frantically packing and getting everything ready. And, the excitement of finally getting this phone call. But within 40 minutes, Morgan called back and said that not only were the lungs hep C, but they were testing them for HIV, because a lot of these hep C lungs, of course, are coming from drug users. So they test for HIV. And she said that repeatedly they had tested these lungs, and the test kept coming back inconclusive. So she said there was no way to rule out HIV, and they're going to have to pull the offer back. That was tough. We'd heard about what they call dry runs. Sometimes you don't know till you're right going into the OR. We only had 40 minutes of excitement before our hopes were dashed, but it was definitely a down moment. And then it was 5 days later that Morgan called again, and this time beautiful, healthy lungs, no hep C, no HIV, and it was worth the extra 5 days to wait. So I mentioned Dr. Tomich inviting us into the study already. I think another encouraging moment was when I woke up finally in ICU. and I was alive. And I had no oxygen, supplemental oxygen. I was in a lot of pain. I looked like Frankenstein. I had tubes and IVs and chest tubes and catheter and central lines. And I mean, it was unbelievable what they had me hooked up to. But I was alive and breathing and knew at that moment I have potentially many years to live with my beautiful wife and enjoy our family and travel and all those things that seemed like were never going to happen. So hugely encouraging moment in ICU. Yes, and this would probably be the only thing that we would maybe suggest to the hospital that you incorporate more. We were really kind of frustrated during the waiting period when I was getting more and more sick. I could not lie down because I would cough like crazy, so I couldn't sleep. It was almost over 5 weeks that I didn't get any sleep. And when we told people, doctors at the hospital, this is what's happening, the answer we got back was, yeah, this is a really tough part of the journey. When we talked about how much mucus I had, that I literally felt like I was drowning in my own mucus. Again, the answer was, yeah, that's one of the indications of the lung cancer. It's really tough, but no help, and this is the only thing I would say was a little bit discouraging, is that when we asked these kinds of questions from the hospital team, the answers seemed to be too limited to Western medicine and, finding a pill or a procedure. When I was in the hospital in April, they put me on CPAP for sleep apnea, and they were able to hook the oxygen, the supplemental oxygen, to the mask. So I could wear that at night, still get the oxygen, and it was the first time I was able to sleep. Well, I begged for a mask like this when I went home so I could get my oxygen at night and sleep. And we were told, I'm sorry, the hospital can't issue that sort of equipment, because I did have a CPAP at home, but I had like a nasal cannula, and that wouldn't work with the oxygen. I needed a mask with an oxygen adapter. So we begged for it. I even had one of the respiratory therapists try to rig one up for me, but the hospital couldn't provide that and said that the only way I could get a mask would be through a sleep study, which of course I couldn't do at the time because I was dying and I was on oxygen. So that was frustrating too, finding out there's a solution to me being able to sleep, but no one's able or seemingly willing to provide it. Who knew? My wife went out on Amazon, was able to get a mask on Amazon and a $1.50 adapter for the oxygen. So we ordered it and I used it, and for the first time again, I could lie down and sleep at night because she took things into her own hands. The other brilliant thing she did is that she got absolutely frustrated with nobody being able to help us with all of this coughing and mucus. She went out on YouTube and found a video of a nurse showing what she called percussion massage, where she would cup her hands and pound like this on my back for 5 minutes every morning and every night. And that literally broke up the mucus in my airways so I could get it out and I could breathe. So there was this feeling of like, how are they not recommending this to all of the patients who are just struggling and struggling, and then just being told, yeah, this is a really tough part of the journey. So that was frustrating. We don't blame anyone for that. They're real and they work and patients need them. So, we hope that, well, I'll mention, from my wife Lori's interview last week, she's writing a book about all this. She is a brilliant, gifted author, published already, and she's been keeping track of all of this. We were told in our initial meetings here with Northwestern that we should start a GoFundMe campaign, which we did, and we are so grateful for the unbelievable outpouring of love, letters, financial support that's come to us. But Lori is updating that all the time. And that's how she realized, in sharing all this information with people who've been so grateful for it, who some of them know people who have lung cancer. They want to pass that on. Do not give up hope. You know, no matter what we're being told, no matter what the circumstance or the diagnosis is at the moment, don't give in to that. You know, she kept saying, right, hold on, you never know. New medicines, new procedures. And she was right. 2 years later, I got on that Tagrisso. 2 years later, this double lung transplant became available, which 2 years ago had never been done. This solution did not exist for late stage lung cancer patients. So when Dr. Barat here pioneered this 2 years ago, suddenly an option became available not just for me, but for many others that had not been available just 2 years prior. So definitely the biggest lesson was do not give up hope. Hold on, stay as positive as you possibly can. Try not to give in to the fear, because it is scary. There are a lot of emotions that happen when you're told that you're not going to live. Hold on. Yes. You know, as a student in particular, I think you spend quite a bit of time, as you need to, in books, in class, being taught and mentored. It might become easy to focus on the academic and the intellectual part of the medical profession. And so the advice I would give is to remember that on the other side, you're dealing with real human beings who are facing end-of-life issues, who do care, as I did. I had questions about what was happening and what the procedures were, but at the end of the day, that was so less important than facing emotionally, psychologically, the fact that I'm dying, that I'm not going to be with my wife anymore. Get to see my boys possibly get married and start families of their own. So just a reminder that this is the kind of stuff, I mean, you can see how emotional it is just thinking about it. This is what your patients are dealing with. And you have to have the academic, you have to have the intellectual. It's what makes the world-class healthcare here so amazing. But always remember you're dealing with real people, with real feelings, and combining that care is, I think, what's so important. Well, it's just reiterating the message that I learned from my wife. Never give up. Never, ever, ever give up. Because you just don't know what's coming. And the longer you can keep yourself going, the longer you can be positive, the longer you can take all the steps you need to take as good care of yourself as you can. And hopefully you have the kind of amazing caregiving experience I had with my wife, who was just a rock for me. I literally would not be here without her. I could not have made this. It was so challenging. So my encouragement to you, if you're struggling like I was, is just to not give up hope. Because again, you never know what's coming down the line. And you might, and I hope you do, have the experience that I had, that your life could be saved by something as miraculous as this double lung transplant they're now doing and perfecting here at Northwestern Medicine.